You got the surgery, you did the rehab, but something still feels off. Your new knee works, but it doesn't feel normal. It's not your imagination, it's biomechanics. I'm Jess. I've been a licensed massage therapist since 2008, a licensed acupuncturist since 2014 with an extensive background in sports medicine and nutrition, and I worked years directly in the OR with orthopedic surgeons as a medical sales rep, guiding total joint surgeries, including hundreds of knee replacements. I have seen firsthand what patients are not being told before and after their surgeries, and I'm here to fill in the gaps. So whether you've already had a knee replacement or you're trying to avoid one, this series is for you. Let's dive in. After COVID hit, I closed my practice in Denver and stepped into the OR, literally. I worked as a medical sales rep for Smith & Nephew, assisting trauma and joint surgeons during knee replacements. My job? To guide scrub techs, double-check x-rays, and make sure the right implant size was used. I saw these surgeries up close, and let me tell you, the engineering is impressive, but it's not perfect. In a natural knee, the femur rolls and glides on the tibia in a very specific way during bending. Especially in deep flexion, your knee does a subtle twist and shift called rollback. It's how you kneel, squat, or lunge smoothly. This motion is guided by the unique shape of your femoral condyles, one longer, one shorter, asymmetrical by design. Now here's the kicker. Most prosthetic knees are built with symmetrical condyles, meaning that delicate natural rotation, gone. The implant prioritizes stability and durability, not a perfect copy of your native anatomy. So if you feel like your range is limited or your movements feel mechanical, it's because it is. Some companies like Smith & Nephew, who I used to work with, are designing more ergonomic options to mimic this rollback. These newer implants try to replicate natural kinematics a bit more closely. But let me be clear, I no longer promote any one brand. This isn't a plug, it's just the truth. And the truth is, no implant, no matter how advanced, will fully restore what nature gave you. So what does that mean for you? It means your recovery must focus not just on pain relief, but on accepting the new rules of your body. You can absolutely regain function, confidence, and freedom, but expecting to feel the same as before surgery will only leave you frustrated. And that's where holistic care, like acupuncture, strength training, and gait repatterning comes in. This isn't a downgrade, it's an upgrade that needs new software. Understand your limits, train within them, and learn how to move in a way that supports your unique, beautifully rebuilt body. Thanks for watching. I hope you found this information valuable. If you did, hit that like and subscribe button. And if you want to go a little bit deeper, head over to my website. I'll leave the link down below. There you'll have full access to my blog series, courses, health coaching, and many more tools to help you feel better, move better, and just take your health back into your own hands. So remember, keep moving, eat something green, and question anything that sounds like a quick fix. Ciao, ciao.